Hi, this is Kirsten Olegzak, Catherine Kramer, and Madison Miller from Team 4, and we will be discussing how hospitals are addressing some of the difficult ethical problems related to end-of-life treatment. The United States population is aging. In fact, every 13 minutes, 100 people will turn 60. This aging population means that hospitals are increasingly being faced with the difficult ethical problems in regards to end-of-life care. End-of-life care is care given to individuals who have illnesses from which they are not expected to recover. The goal of this care is to keep the patient comfortable without major efforts to sustain life or speed up the dying process. Focus is on pain management and the psychological effects of the illness on both the patients and the family members. This care can occur either at home or in the hospital. Due to the nature of end-of-life care, ethical dilemmas such as patient autonomy, costs, and a physician-assisted suicide occur frequently. Therefore, it is important that doctors follow ethical guidelines when deciding how to handle these situations. One of the biggest ethical issues when it comes to end-of-life care is the maintenance of patient autonomy, or their ability to have control over what treatments they receive and which ones they would rather not have. One of the ways hospitals are ensuring patient autonomy is through the utilization of advanced care planning. This is when the patient, the physician, and the caregivers get together in order to discuss future care for the patient and what they would want that to look like. All parties involved would come to a common agreement to prevent future cases of misunderstandings. Advanced directives are critical in this planning, as it details the patient's desires in case they become unable to make competent decisions on their own. They may discuss which caregiver will make decisions for them or create a living will. This ensures that the patient's wishes for their end-of-life care are being met and they are not given any treatments that they would object to if able.
Hospitals are addressing ethical problems with withholding or withdrawing treatment by making sure that they address and speak to the patient and family with detailed information about the benefits, limitations, and drawbacks. If the patient insists to prolong life with medically advanced treatment interventions, the physician has the responsibility to explain the information facts about this medical treatment and see to it that there is no unnecessary utilization of resources for the futile treatment. Physicians should respect the beliefs and values of the patient before deciding on a treatment. Physicians also have to reach a mutual agreement with the patient about withholding or withdrawing a futile treatment and explain the drawbacks of unrealistic expectations from the treatment. An ethics committee is characterized as a body of persons established by a hospital. They are assigned to consider, debate, study, take action on, or report on ethical issues that arise in patient care. Ethics committees are a big part of how hospitals and other healthcare facilities address difficult ethical problems related to end-of-life treatment. Their job is to form ethical guidelines and rules when it comes to deciding end-of-life treatment, but they also put into consideration of what the patient and their families desire. One of the difficulties that hospitals face is a patient's right to autonomy. Autonomy gives patients a right to control their treatment according to their preferences, though many times their autonomy is not respected. Physicians have to work against the egoistic theory by working for the good of the patient. The expenditure on healthcare is too much in relation with the total number of people and outcome. About 1/4 of all Medicare spending goes towards care for people during their last year of life. The reason spending is so high for those end-of-life patients is that we spend a lot of money on the very sick, but we can't tell the very sick from the soon-to-be dead. Healthcare providers and physicians have to consider patients' preferences and perspective. To avoid problems related to healthcare, physicians have to judge the situation and consider the appropriate treatment prognosis so that patients can make an autonomous choice of treatment. The physician has to provide information about the treatment, especially in case of futile treatment, to avoid any undue harm to the patient. In case of futile treatments, healthcare providers also have to consider the allocation of limited resources available to manage the case scenario and avoid inequity. They also have to address the issue of unnecessary and unequal distribution of resources by withdrawing or withholding the futile treatment.
An increasingly common option regarding palliative care is physician-assisted suicide. Physician-assisted suicide, or PAS, is when a physician facilitates a patient's death by providing the necessary means to enable the patient to perform the life-ending act. It is a controversial issue and could potentially pose ethical problems for hospitals. For example, would doctors willing to participate in PAS be prevented by their hospital's policies, or would they be able to participate regardless of affiliation? Hospitals are addressing this issue by increasing funding to palliative care programs, so physician-assisted suicide is not seen as the only option for patients facing the end of their life. The last ethical problem we would like to discuss is the benefit of home-based versus hospital-based end-of-life treatment. More and more people are wanting to die at home, but with hospitals profiting off long-term patient stays, will they recommend sending the patient home instead of keeping them? Palliative care for patients hospitalized with advanced diseases results in lower costs of care and less utilization of intensive care compared to patients receiving usual care. With this knowledge, we can assume hospitals will not prevent patients from going home to die because palliative care is typically a low-cost expenditure. This prevents the ethical issues that one may think a hospital will run into regarding palliative care. For our discussion questions, we would like to ask you, with home-based end-of-life care becoming more common, how will hospitals change the way they provide the same services? Additionally, we would like to ask, besides the topics mentioned in the video, what are some other ethical issues that may arise with end-of-life care, particularly regarding the increase in new technology that can extend life? Thank you very much for listening.